Day Medical Monday. We've been told that a woman with no family history should get her first mammogram at about 45 years old. But doctors always caution, you know your body best, and breast cancer does not discriminate. Our next guest was not the average age patient. By the time she had symptoms, it was already stage 3. She credits her survival to the team approach at Memorial Hermann Memorial City Medical Center. Survivor and thriver, Jenna D'Amico is with Dr. Michelina Cairo and Dr. Jamie Terry. They are at Memorial Hermann Memorial City Medical Center. Good morning.
Good morning.
All right. I say not just survivor, but thriver as well, because you took the bull by the horns after this. So at 35 years old, you woke up one day and noticed some changes.
I woke up and felt very achy on my left side, and I just thought at first that I slept wrong because it was thunderstorming and all that. So I didn't think anything of it, took Tylenol, and it kept persisting. So then I started actually massaging shoulders and poking around, and that's how I actually found the lump.
Yeah.
Was on my own.
But it's still, when you found the lump, did you expect to hear it's breast cancer, stage 3, aggressive?
No, I thought it was a cyst because cysts run in my family. There's no history of breast cancer in my family. So it definitely was a little bit of a shock to hear at 35 years old that you have cancer and it has spread.
Yeah, yeah. All right, at that age, with those symptoms, I can see a lot of women ignoring it because we have implanted in our head that breast cancer belongs to somebody else, family history 1, and the other thing is, again, at her age, but the importance of paying attention to your own body.
Absolutely. Any lump that persists for more than about 2 weeks absolutely deserves to be checked out. Anything that just doesn't feel right or just doesn't sit well with you deserves to be checked out. Your family practitioner, your gynecologist, your regular doctor can absolutely help do an exam and decide whether you should pursue additional imaging.
Yeah, and by the time you find a lump the size that she found, it oftentimes indicates that it has progressed. There are, what we know today, different types of breast cancer, this one very aggressive.
Well, because you feel a lump doesn't mean it's spread, but what's more important is that you act on your own instincts. Most breast cancer is not related to family history. Most breast cancer is not inherited. So women need to honor their bodies, pay attention, and seek medical counsel so that they can do the workup and evaluation for you.
All right, and so the first thing as a doctor, when someone comes in, obviously there's imaging that may be involved, but once there's a lump, I guess that's where you start, let's figure out what it is,
Well,
right?
you get a biopsy.
Yeah.
We've moved from open biopsies to minimally invasive biopsies. We get cores of tissue, and we do excellent testing to be sure and personalize the treatment for the patient, especially in Jenna's case, since the biomarkers were all negative, we could design a focused treatment for her based on the biology of the tumor.
Okay, explain the biology of the tumor, this kind of breast cancer that was really aggressive.
So this really kind of aggressive breast cancer is triple negative breast cancer. So some breast cancers grow with estrogen, with progesterone, and with HER2, and Jenna's cancer didn't grow with any of those. And so that is the kind of cancer where our targeted anti-estrogen or our targeted anti-HER2 therapies are not going to help a patient like Jenna, and we are relying on chemotherapy as well as surgery and radiation therapy in order to cure this kind of cancer.
Yeah, in this case, it's still not one size fits all when it comes to treatment, is it today?
Never. It's not at all one size fits all. And all of the cases that are diagnosed at Memorial Hermann Memorial City Hospital are brought to our breast cancer tumor board, where we have a team.
You touched on that earlier. That is so important, that team approach, and the fact that you two are part of that team approach.
Yes. We are, that the surgeon and the oncologist are part of the team approach with the radiologist and the pathologist every week in order to review the cases and to help determine what are the essential points that this patient needs to go through in order to start their workup, and also their survivorship. The nurse navigator is a part of the tumor board who helps to provide that guiding care for a patient who might be apprehensive about pursuing this kind of diagnosis.
And let me get to that, because all of us are lost when we're given a diagnosis like that, and we just basically say, here, help me figure this out. And you didn't have to ask and make a bunch of phone calls of help me figure it out.
No.
Talk about the importance of, when you get a diagnosis like that, of having this team fighting for you.
So the patient navigator, Karen Davin at Memorial Hermann, I absolutely love her. She was a godsend. She basically, you just are kind of, thinking of all these things in your head and you can't keep straight and you don't know what to do and where to go, so you just kind of go, hey, this is what I need, can you please do this? And she actually took care of scheduling tests for me and kind of figuring things out and getting things on the right path, so that it wasn't something that I had to, one more thing I had to think about doing.
Yeah.
So I absolutely love her to death.
All right. And Dr. Terry, what's it like on your side as a doctor and to be able to work in a team?
Well, the beauty of the multidisciplinary approach is we're able able to yield high responses to the modality of treatments. The tumor board helps us decide the best order for the treatment. In Jenna's case, she received chemotherapy first, followed by surgery. I worked to coordinate plastic surgery for Jenna, which really helped to move her past her diagnosis and into her survivorship.
Yeah.
So it's the team together that really works for the betterment of the patient, and I'm honored to be here over 10 years later.
Wow, and this is, yeah, and she was showing me pictures on her phone of like over the last several years that you and I
Yes.
have met each other.
Yes.
And we both get better with time is what I told her. Right? but it does change the way you look at life. I know for me, when I
Yes.
had my brain aneurysm that burst and I survived that, it changed the way I look at life.
Yes.
How did it change for you? What do you have to say? There are so many other survivors out there today,
Very
more
much
so than ever before because of
Yes.
our wonderful doctors and medical technology. But also, I know there's someone who just got the words, you have breast cancer. What do you have to say to them?
So first, I have paid it back, and I volunteer for Karen Davin and Memorial Hermann, Memorial City, and for CanCare. And I actually am honored and privileged to be able to help women get through their journey, from whether it be if they're just diagnosed or if they have questions about what type of surgery or how do they just function every day. So I am so lucky that I'd be able to talk to women and help women get through their journeys.
Yeah, yeah. And when people are family and friends, what's the best way to help that person?
You have to take each person individually because each person absorbs the information or handles it differently or processes it and has different situations. Maybe they have kids, or maybe they don't have a large support group, where I was very lucky I did. I had wonderful family and friends that were with me all the time. But you know, to those people, I always tell them, listen, I'm here. This is what I do now. This is where I am. You know, if I can do this, and mine had spread, and I went through the whole gamut, and I'm out now doing triathlons and marathons and biking, you know, all this fun stuff. You can do it. You can get through it. You can keep positive and just take one day at a time and one step at a time and trudge through.
Yeah, and the point that you just said about sometimes we don't have family and friends, that's when you become not only their doctors and caretakers in that sense, but you all become their family and friends. Thank you all very much. For more information on Memorial Hermann Memorial City Medical Center and to book an appointment, you can call this number, 713-222-CARE, 713-222-CARE. It actually works out to be 713-222-2273, or visit cancer.memorialhermann.org.